Hi everyone, welcome back to my YouTube channel, and today we are going to talk about endometrial hyperplasia. So let's start our topic with introduction. Endometrial hyperplasia is a condition that is characterized by abnormal thickening of endometrium. Endometrium is the inner lining of uterus. It occurs due to an imbalance between estrogen and progesterone, leading to excessive proliferation of endometrial cells. While often benign, endometrial hyperplasia can sometimes progress to endometrial cancer, making early detection and management crucial. Causes of endometrial hyperplasia. The primary cause is prolonged estrogen stimulation without adequate progesterone. Contributing factors include obesity that increase estrogen production from fat tissue, polycystic ovary syndrome, hormone replacement therapy that is unopposed estrogen use, chronic anovulation that is failure to ovulate regularly, and certain ovarian tumors that secrete estrogens. Types of endometrial hyperplasia. Endometrial hyperplasia is classified based on cellular changes. It may be simple hyperplasia without atypia, that is mild glandular proliferation, and there is low risk of cancer in this. Second type is complex hyperplasia without atypia, that is more crowded glands, and but there are still low cancer risk. Third type is simple hyperplasia with atypia. This is abnormal cell changes there in this tissue, and it has high risk of progression towards the cancer. Fourth type is complex hyperplasia with atypia. In this case, there is significant cellular abnormalities and high risk of developing into endometrial carcinoma. Symptoms of endometrial hyperplasia. Common symptoms include abnormal uterine bleeding, that is heavy, prolonged, and irregular period. Second is postmenopausal bleeding. Third symptom is spotting between menstrual cycle, and infertility can happen in some cases. Diagnosis of endometrial hyperplasia. Diagnosis involve transvaginal ultrasound, that is to measure endometrial thickness. Endometrial biopsy, that is gold standard for detecting hyperplasia and atypia. Hysterectomy, that is direct visualization of uterine cavity. Dilation and curettage, that is sampling of endometrial tissue for analysis. Complications. If endometrial hyperplasia is untreated, it can lead to progression to endometrial carcinoma, especially in cases with atypia. Chronic abnormal bleeding. It can cause anemia due to heavy blood loss, and it can cause reduced fertility. Treatment of endometrial hyperplasia. Treatment depends on type and severity. If endometrial hyperplasia is without atypia, it is done it is treated by progesterone therapy that includes oral or injectable or intrauterine device containing progesterone. And second thing we do is lifestyle modification that include weight loss and managing PCOS. But if the endometrial hyperplasia is with atypia, the treatment options are hysterectomy, that is definitive treatment, and it is especially for women that do not desire fertility. And high dose progesterone therapy is given for women wishing to preserve fertility. So there are two cases: if the woman wants fertility and if woman don't want fertility. If woman don't want fertility and the patient is endometrial hyperplasia with atypia, we go for hysterectomy. But if women want fertility, then we go for high dose progesterone therapy. Then we do monitoring, that is regular follow up with biopsies or ultrasound to assess regression. Prognosis of endometrial hyperplasia. Hyperplasia without atypia has a lower risk of progression and respond well to progesterone therapy. Hyperplasia with atypia carries a significant risk of developing into endometrial cancer if untreated. Early diagnosis and appropriate treatment greatly improve outcomes. Prevention of endometrial hyperplasia. Prevention measures for endometrial hyperplasia include maintaining healthy weight, managing PCOS and other hormonal disorders by using combined estrogen and progesterone therapy instead of unopposed estrogen. It can be prevented by regular gynecological checkup, especially for women at risk. Conclusion of this lecture video. Endometrial hyperplasia is a condition of abnormal endometrial thickening that is caused by hormonal imbalance. While many cases are benign, atypical hyperplasia poses a serious risk of progression to cancer. Early detection through biopsy and appropriate treatment, ranging from hormonal therapy to hysterectomy, are essential for preventing complications and ensuring reproductive health. And this was all about endometrial hyperplasia. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.